Australia is in the grips of a tough winter, with medical experts warning 2024 is on track to become the worst year of whooping cough in nearly a decade. Confirmed cases for the potentially deadly disease have hit more than 11,000 so far this year, compared to just over 2,000 the whole of 2023. Wow. The surge has prompted health authorities to issue an urgent reminder for people to stay up to date with their vaccinations. But with the knock-on effects of COVID, it seems some Aussies are less than eager to get the jab. For more, we're joined by Sunrise GP, Dr. Ginny Mansberg. Good morning to you. It feels like we've got a bit of jab fatigue at the moment. Whooping cough, why has it spiked?
Don't know. I mean, it has gone up around the world. This is not just an Australian thing. We're seeing it in China, in the US, in Europe, all sorts of places. And it's probably a combo of the jab fatigue that you were talking about, but also I think we've got respiratory hygiene fatigue. You know, you're meant to cough into your arm, into the crook of your arm, and maybe throw your tissues away and wash your hands afterwards. We've kind of forgotten all of that as well. They're probably contributing. Yeah,
the sanitizer and all of that. Rates of whooping cough unreasonably high in school-aged kids. Why is that? Is that because they're sharing it around? Yeah,
so I think there's a number that possibly missed their 4-year vaccines during COVID, when we had major COVID fatigue. And that vaccine's only going to give you protection for sort of 10 years. So some of those children, if they haven't been vaccinated since they were 18 months or even earlier, they've run out. So we're really seeing it year 4, year 5, year 6, year 7, that kind of age group has really got it. They do love huddling together. You know, their respiratory hygiene is not the best. But it is interesting that we think almost half of them are catching it from adults, often in their families, and it's our age group that are so slack on getting vaccinated.
And there are so many other things going around. You may not know if it is whooping cough at the moment, because there seems to be a cough attached to so many different things. Why is it so important right now? And I look back, so my sister's daughter's 8 years old now, and I had whooping jab then and the booster then, but that's almost 8 years. So I need to get another one soon, but I don't have any youngsters in my family anymore.
Yeah, but you don't want to be spreading it to, like, your niece or parents, because the ones who get in hospital are the under ones and the over 65s, because it's a 100-day cough and it's exhausting you. Cough and cough and cough, particularly at night. You have these coughing spasms. You often can't breathe afterwards. It's very unpleasant for the older ones. But even for our age group, the 100-day cough, who needs that? Like, you just don't need it.
Take us through the signs. Because whooping, is it all about that kind of whipping sound? Or?
Yeah, look, I've never heard a whoop except for like on YouTube videos when I was, in medical school trying to learn about it. I think what you tend to see is a bog standard cold, and then a week later in comes the cough. And the real thing that we're meant to be looking out for is coughing spasms, coughing fits that just keep going. Often, afterwards you can throw up or just can't breathe. A baby can turn blue, and sometimes there's a whoop, but not very, very common. So, and it lingers 100 days.
Okay, so masks on, wash your hands again, cough into your elbow, all that sort of stuff, and get the jab, of course.
Yeah.
Thanks, Ginny. Appreciate it.